What early signs suggest cystic fibrosis? Imagine a baby with a very salty taste on their skin or a little one who keeps coughing with thick mucus. These might be clues that something is going on inside their body. Cystic fibrosis is a genetic condition that mainly affects the lungs and digestive system, and early signs can help doctors catch it sooner. One of the first signs parents might notice is that the baby's skin tastes unusually salty. This happens because people with cystic fibrosis have higher salt levels in their sweat. Sometimes, parents can notice this when they kiss their baby's skin or if a sweat test is done. The sweat chloride test measures the salt in sweat and is a key part of diagnosing cystic fibrosis. In terms of breathing, children with cystic fibrosis often have a persistent cough that doesn't go away. They might cough up thick, sticky mucus, which can make breathing difficult. Wheezing or shortness of breath can also occur, especially during activity or colds. Repeated lung infections like pneumonia or bronchitis are common because mucus buildup traps bacteria. Sinus infections and nasal congestion are also frequent, sometimes with swelling inside the nose called nasal polyps. Digestive issues are another big sign. Babies may have trouble with bowel movements, showing signs like constipation or very bulky, greasy, foul-smelling stools that are hard to flush. Some stools might be lighter in color or contain mucus. Children might experience abdominal pain, bloating, or swelling. Poor weight gain is common, even if they eat enough food, because the body isn't absorbing nutrients well. This can lead to slow growth and delayed puberty in older children. Some newborns have a condition called meconium ileus, which is an intestinal blockage that can be an early clue. Other signs include clubbing of the fingers and toes, which means the fingertips become rounded and enlarged due to low oxygen levels over time. Small growths inside the nose called nasal polyps can also appear. Fatigue or tiredness is common because the body is working harder to breathe and digest. In boys, cystic fibrosis can cause the absence of the vas deferens, which can lead to infertility later in life. Since cystic fibrosis is caused by a mutation in the CFTR gene, symptoms can vary widely. Some people might have mild or atypical symptoms that show up later in life, even during adolescence or adulthood. Early diagnosis is very important because it allows for better management of symptoms and improves quality of life. If you notice any of these signs in a baby or young child, it's essential to see a healthcare professional promptly. Diagnosis usually involves newborn screening and confirmatory tests like the sweat chloride test, which checks the salt level in sweat. Remember, every individual is different, and only a doctor can provide an accurate diagnosis and appropriate care. Always seek medical advice if you have concerns about cystic fibrosis or its early signs.